Hello, my name is HanK. Nice to meet you all. I wish I could meet you under other circumstances, or better circumstances rather. But today I am trying to raise awareness of the healthcare system provided to our veterans that appears to be substandard. And I only say that due to my experiences with the process of healthcare through, I guess, the VA. As we know, the VA, once you retired or separated from the military, given that you are retired and separated with honorable services, you should be able to acquire health treatment by the veterans hospitals, VA hospitals. And it's a right that veterans earn from their services that they sacrifice doing while providing, I guess, services for this country. And it's very painful to witness anyone to not be provided health care regardless. But it's extremely disheartening knowing that our veterans are getting substandard health care. A lot of people disagree. I understand. And how could it be so bad if it's technically free? Well, people, it's not free. Just speaking from experience. Because when you're dealing with pain or psychosomatic issues every day of your life, for the rest of your life, as a result of the jobs, duties, and devotion that a person provides while they are on active duty, that individual should be entitled to the healthcare system's support. But in recent history, I've learned that is not accurate or not even true. And I am trying to bring awareness to unknowing folks, or provide an outlet for persons such as like myself that are in a similar situation to be able to discuss their issues or conflicts. So if you have an issue with the VA, despite what state you may be living in or whatever VA that you may be having issues with, please do share. Most recently, I have experienced issues in the manner of surgery. I underwent a process or procedure that was flawed at the Bay Pines VA in St. Petersburg, Florida. It was a simple procedure. I came out, and a month later, things went south quickly, to the point where it is causing significant health issues on my part. And if you would like to know more, please inquire. I have no problem sharing my story with you, but I don't want to just focus on myself, because there are so many others that have been suffering for as long, if not longer, than I have. And my heart goes out to those patrons or veterans, because they are suffering through a situation that they should not be required to suffer. I'll give you a brief example of what I'm explaining or trying to share with you. For my situation, I was supposed to have had a simple hernia repair procedure done. And that happened back in 2016. Recently, I have learned that the mesh that was put in place has adhered to my intestine and has actually cut soft tissue in the surrounding areas, causing inflammation, infection, and so on. Well, I have since approached the surgeons that did that surgery to explain to them and try to get their help to go in and fix it. I mean, just fix what they failed to fix. Because even the incision that they made did not heal correctly. The staples fell out, the incision started to separate, and rather than having a scar, I have this big bulge the size of a volleyball in that area, and the scar had spread and is as wide as this, as a couple of inches, and it should be very narrow. But it's only as wide as it is because my intestines have gone through that incision that reopened, and my intestines are starting to push themselves out. And I have gone to the surgeons that did this procedure to acquire their help, and I have been told, from being identified as practically being crazy, because the doctors say that the pain I experience from the swelling, the stretching of the soft tissues, the actual tearing of the soft tissues, the cutting of the soft tissues from the mesh, and so on, the pain from those items or issues are in my head. I've also been told that I've been trying to acquire access to narcotics. I have been told by the same surgeons that they will not be bullied into doing a surgery that they are there to provide services for to begin with. So all my sacrifices and hard work for the last 22 years of my military career was not significant enough to earn the surgeon's approval at the Tampa Bay Pines VA. It's actually located in St. Petersburg, Florida. But they have informed me that they will not be bullied into doing surgery, even though I am entitled that surgery. So rather than engaging and doing their job that fits their job description, rather than the surgeons engaging and doing their job that fits their job description to repair the damage that they actually created, they have told me that they will not engage, and I was left to deal with it. People, that is a form of torture. Just to have to deal with the pain is a form of torture. And then being scrutinized, judged, demoralized, accused of being called a liar, and denied the very treatment I earned. But the doctors at the Bay Pines VA in St. Petersburg, Florida, have established their network so that persons like myself that come in with ailments do not have a substantial voice to be heard in the midst of trying to find a process of healing. And it gets worse as the time goes by. There are more and more people being exposed to this maltreatment. It has gotten so bad that most recently, just in early month of December of 2018, a fellow brother-in-arms, I'll say, retired from the Marine Corps with honors, combat warrior, and he's a colonel, had committed suicide at the main entrance of the Bay Pines VA Hospital in St. Petersburg, Florida, because he was being denied treatment for his ailments that he earned. People, this is a significant issue. It is pretty bad when the doctors that are placed in a system to help those that did their job and sacrificed as much as what veterans sacrificed to do their job to help protect this country. I mean, literally. Without the presence of our military, the threat would be fathomable. I mean, our country would be exposed. It would be compromised. And our veterans are being treated less than human by the physicians put in place in a system that they are supposed to be helping. But yet they don't, the doctors choose who and when and how they want to help. Yes, there are a handful of veterans that acquire the necessary treatment, but there are things that fall in line or in place that helps their situation be successful. But more than not, what I have learned and witnessed, that if a doctor just finds a reason to not want to be a part of it, that's it. They're done. It is horrible. So I am attempting to reach out and try to bring awareness to not just other veterans, but to common citizens. Because in the future, moms, dads, brothers, sisters, your kids will eventually decide whether or not they want to be in the military. Would you be comfortable knowing that if they went and would sustain an injury that could be life-altering, would you be comfortable or happy knowing that the doctors that they would be required to see in a system that is designed for their own personal well-being is deciding on their own judgment to deny your child their right for treatment? It's a pretty big deal, because personally I'm working hard to convince my kids to not join the military now because of my experience, because I do not want my child to endure the issues that I have had to go through. I would much rather my kids go to school and earn a college degree than go and earn experience through the military. And that is sad to say, because I am a through and through patriot. I really am. I love my country. I love the job I did. I'd do it all again despite the situation I'm in. Because the people I worked with were a handful of individuals that are unparalleled to those that I've ever experienced being around before. And I'm not saying that common everyday citizens are less, but I'm just saying that those that were in the military took great pride in being in the military and had a sense of acceptance or of success for doing the job that they were doing. And there lies the reason that most people that are in the military would do that job again. And it's upsetting to learn how upside down the healthcare system actually is, that it was put in place to help our veterans to become engaged in society again, I guess, and be able to function at minimum on doing just daily activities and chores that they would normally do, that most people would probably take for granted, such as vacuuming, sweeping, washing dishes. I mean, a lot of these individuals are limited and not being helped. And with your awareness, maybe you can help make a change.